nurse is performing hand hygiene? Which action indicates correct technique? A. Washing hands for 10 seconds. B. Using alcohol-based sanitizer on visibly soiled hands. C. Washing hands for at least 20 seconds. D. Wearing gloves instead of hand washing. C. Washing hands for at least 20 seconds. Rationale: hand washing should last at least 20 seconds to effectively reduce microorganisms. Why the other options are incorrect? A. Washing hands for 10 seconds. 10 seconds is insufficient time to adequately remove microorganisms from the hands. B. Using alcohol-based sanitizer on visibly soiled hands. Alcohol-based sanitizer is not effective on visibly soiled hands. Soap and water must be used instead. D. Wearing gloves instead of hand-washing gloves do not replace hand hygiene. Hands must be cleaned before and after glove use. Which is the most important nursing intervention to prevent pressure injuries? A. Turning the patient every 4 hours. B. Keeping the skin clean and dry. C. Using a donut-shaped cushion. D. Limiting fluid intake. B. Keeping the skin clean and dry. Rationale: moisture increases skin breakdown. Keeping skin clean and dry is a key prevention strategy. Why the other options are incorrect? A. Turning the patient every 4 hours. Repositioning is important for pressure injury prevention, but turning every 4 hours is not frequent enough. High-risk patients typically require repositioning every 2 hours or more often. C. Using a donut-shaped cushion. Donut-shaped cushions actually increase pressure on surrounding tissues and can impair circulation, which may worsen skin breakdown rather than prevent it. D. Limiting fluid intake. Restricting fluids does not prevent pressure injuries and may contribute to dehydration, which increases the risk for skin breakdown. Which vital sign is considered abnormal? A. BP 118/76. B. Heart rate 88. C. Respiration rate 24. D. Temp 98.6 degrees Fahrenheit, 37 degrees Celsius. Respiration rate 24. Rationale: normal respiratory rate is 12 to 20 breaths per minute. Why the other options are incorrect? Heart rate 88. A heart rate of 88 beats per minute is within the normal adult range of 60 to 100 beats per minute. BP 118/76. This blood pressure falls within the normal adult range, approximately 90/60 to 120/80 mm Hg. Temperature: 98.6 degrees Fahrenheit, 37 degrees Celsius is a normal oral body temperature and does not indicate abnormality. The nurse should use a gait belt for which patient? A. Completely independent patient. B. Patient with unsteady gait. C. Bedbound patient. D. Patient in traction. Patient with unsteady gait. Rationale: patient with unsteady gait. A gait belt provides safety and support during ambulation and allows the nurse to maintain control if the patient loses balance. Why the other options are incorrect? A. Completely independent patient. A completely independent patient does not require assistive devices for safe ambulation. C. Bedbound patient. A gait belt is used for ambulation or transfers, not for patients who are unable to get out of bed. D. Patient in traction. A patient in traction should not be ambulated with a gait belt, as movement is restricted and could disrupt alignment or treatment.